Hello and welcome to this multimedia series on the environment on CNC3. I'm Ira Mathur. Well, we cannot do an environmental series without firstly acknowledging the suffering of the people of Pakistan. 1,600 people have died as a result of the recent floodings. Some 20 million people have been affected and more than 6 million people face imminent starvation. Hospital beds are overflowing there. Officials say 650,000 homes have so far been destroyed across the country. 1.4 million acres of agricultural land have been flooded. Analysts say the crisis in Pakistan has the potential to herald a regional catastrophe with implications way beyond Pakistan. It doesn't stop with the flooding. Water-related diseases such as cholera are also on the rise there. Back in Trinidad, in the midst of the flooding, there were reports of 3 confirmed deaths and over 600 confirmed cases of people suffering from dengue fever this year. My guests today with the information that could save our lives are Dr. Avery Hines from the National Surveillance Unit, Ministry of Health, and Dr. Dave Chady, the Senior Lecturer of the Faculty of Science and Agriculture from UWI. These two men are among the world's top experts on dengue fever and its causes. Welcome, gentlemen.
Thank you.
Dr. Hines, let me begin with you. The last statistic we heard was 600 people were affected with dengue, 3 confirmed deaths, 2 unconfirmed deaths. What is the latest statistic?
You know, what the Ministry of Health does is it will update the entire national public in blanket format with either a press release or a press conference. We will note that as the weeks go by, the number of cases will increase. The last figure was that we were up to between 900 and 1,000 cases. You get a proper update from the Ministry of Health in the normal and expected format of either a press release or a press conference with the exact figure. But as we go from week to week, more cases will be reported. Now, I just want to make a little distinction between confirmed cases and reported cases. What we have is several hundred reported cases. The confirmation, we're not required to confirm every single case because of the volume of dengue that is expected in the country. So the laboratory confirmation isn't what is the criterion for reporting on dengue. However, for a death to be reported as being dengue related, laboratory confirmation and other post-mortem, etc. information needs to be made available for the confirmation to be verified.
So those 2 unconfirmed deaths, have they been confirmed
as yet.
Dengue? Not as yet. And that's been over 2.5 weeks and it's not been confirmed. But let me get to you, Dr. Chady. Dengue is a mosquito-borne disease which is endemic in Trinidad. Now, what exactly does endemic mean? Is it also endemic in Tobago?
The disease is endemic in Trinidad and Tobago. When you say endemic, it means it is naturally occurring within a country. And that's the definition essentially. So we do have dengue in Trinidad and Tobago. We got 3 circulating viruses, although there are 4 serotypes of dengue. The identification of 3 serotypes have been made within recent months.
Now, there weren't that many reported cases of dengue before 1989. After 1990, we saw that dengue figure leap up. Why the increase? And now you're saying the figures may be as high as 1,000 people with unconfirmed cases of dengue in this country.
Now, the increase between a period as far back as 1989 and the current time can be due to a number of things, including a change in the way that information is collected. But I believe that there are figures for periods extending back before 1989, but those may not necessarily be in electronic format, so they're not as easy to access. You'd have to go back and do some data exploration with the printed data in order for that to be made available.
But why the increase?
The increase in terms of between 1989 and present is due to a number of factors. Number one, we are getting better at determining that a person with a given set of symptoms is dengue. So the persons who may have eluded the capture of the surveillance system in previous years have been now included in the more up-to-date and improved case definitions that are being applied to patients coming into the health facilities. In addition, there are environmental factors that would encourage or increase the breeding of the actual vector. And where there is the vector, you will have cases of dengue. And that's something to which I suppose also Dr. Chedi may be able to speak. But I just wanted to circle back for a minute to the endemic concept, because the endemic, quite apart from naturally occurring, means that it occurs within the country at all times at given and expected levels. And the levels are what determines whether you go from endemic and normal numbers or expected numbers of cases to epidemic or greater than expected numbers of cases. So I just wanted to make the difference, the distinction between the two.
Are we close to the epidemic figures yet? Because I know in Barbados, they're very worried about what's happening with dengue over there.
Okay, well, we've actually surpassed that epidemic threshold, so to speak. We have declared that the rates at which the dengue cases were occurring, even before we got to any threshold, the rates at which the cases were occurring were rates that would lead to an epidemic. The other thing that was very important is that you don't have to have numbers that constitute an epidemic in order to take the necessary action. So what we'd really like is to get people out of the mood of only responding to hearing the word epidemic. If we have increases in numbers of dengue cases, we need to take the necessary actions.
So Dr. Chedi, should we be worried in Trinidad and Tobago?
Well, I just want to go back to the 89 question. Historically, what has happened is that within the Caribbean region, there were outbreaks of dengue and hemorrhagic dengue in Cuba, for example, and there were outbreaks in Jamaica. During this period, the whole region was put under alert, and fortunately, Trinidad had initiated a Aedes aegypti eradication program, which was quite successful up to the 1980-85 period. And then the system broke down because the eradication program started in 1976. So due to normal fatigue among workers, people, it's a monotonous job, and the program actually lacked focus. And so what had happened was that the program actually started failing. And as a result, the index or the indices of the mosquitoes started increasing in alarming numbers. And coinciding with that was the other outbreaks within the Caribbean region. And since dengue fever and the virus are imported by human populations coming through Piarco or through the docks, the individuals came to Trinidad, and with the vector population in large numbers, they were able to establish transmission within the region and to actually have it dispersed to the different parts of Trinidad and Tobago.
How dangerous is dengue compared to other communicable diseases?
Well, I just wanted, maybe Avery should deal with that. But what happened then was that when there were, the second serotype of dengue arrived, and there is a paper written by Paul Tilak Singh where he identified the first 5 cases of hemorrhagic dengue. Getting there was, I think it's 85, 86. And that started the domino effect. And so by 1995, there were more dengue hemorrhagic fever, and then by 1998 was the first real epidemic of hemorrhagic dengue in Trinidad. So it's been going on silently for a long time, and very little action has been really taken with respect to the environmental factors. Trying to control the mosquito is just one activity, but there are a multifaceted approach that is required, and so the success has not been good. Maybe Avery,
we'll talk a little bit more about the environmental factors in a minute. We'll take a short break. This is an environmental special on CNC3. We'll be right back.